Hi, I'm Diana Scott, RN with Seniors and People with Disabilities, and we're going to resume our discussion of the Fatal Four with the most exciting topic, constipation. So if you want to turn with us in your handouts that should be included in your packet, we'll begin with that topic. Well, the definition of constipation, as you can see by the slide, is has a little bit of a variety to it. It can refer to hardness of bowel movement, difficulty in the passage of stool, or infrequency in passing stool. Normal frequency varies from person to person, and so the most important thing for you to know here is that normal is person-specific. What is normal for one person may not necessarily be normal for another person. Therefore, a change in the normal bowel patterns, routines, toilet habits of an individual might indicate that there's a problem that needs further investigation. So what you need to do is become aware of and know what is normal for the individuals that you serve. Our next slide shows the anatomy that is involved with constipation as a problem. And so as you look at that slide, I'll just walk you through the normal digestive process real quickly so that you can get a handle on constipation as it deviates from the normal process. So as you watch the anatomy as we go down, the food comes in the mouth where it's chewed and it's broken down mechanically, and it's mixed with secretions in the mouth and the stomach, which starts the digestive process. And then as it's swallowed and moves into the stomach, it gets churned up and mixed more with acids in there, and then it begins to move into the small intestine where nutrients are absorbed. As it moves into the large intestine, water and some more electrolytes are reabsorbed back into the system, and then it goes into the colon where the filling and stretching triggers the release response from the body. What I want you to notice there is that from the mouth to the rectum, you have one great big long muscle. And as we move into why individuals and how individuals with developmental disabilities may be at risk for constipation, that'll be important for you to know. The first thing that we're going to talk about is that they may have syndromes with hypotonia, which is low or absent muscle tone. So if you think of that digestive tract as one great big long muscle, then it'll make sense to you now that if they have a muscle syndrome where their muscle tone is low or absent, that it can affect the digestive process and lend itself towards the problem of constipation. Some of those syndromes might be Down syndrome or Prader-Willi. Some of the individuals that we work with have poor swallowing or chewing. They have issues with that, and therefore their fluid intake and their may not be what it ought to be. They may be on mechanically altered diets related to a swallow issue. Sometimes when we alter the diets, we don't have as much fiber in them as we ought to, or as much fluid in them as we ought to, and that might lend itself towards constipation. Individuals who are non-mobile or non-ambulatory, such as individuals with spastic quadriplegia, cerebral palsy, they need positioning to facilitate the movement that you and I, who don't have ambulatory and mobility issues, get on a daily basis from the moment that we get out of bed in the morning, where we sit up and hang our legs over the edge of the bed and bend over to put our shoes on, our slippers, whatever, and then we stand up and we move around through the process of just doing the things that we do in the normal process of our day. We move a whole lot. And as we move, we affect the movement of our digestive system. So an individual who's non-mobile or non-ambulatory, they don't have that natural movement of their body that helps to facilitate that gastrointestinal motion that helps to minimize potential problem of constipation. Some individuals take medications that have the side effect of constipation. You might have noticed, if you've ever looked into any of our drug reference books, that most medications will list a problem of constipation as a side effect. Particularly psychiatric medications and pain medications have that problem. Some individuals might have particular behaviors or habits that lend themselves toward this issue. People with post-traumatic experiences, people with pain issues who take pain medications, people who have issues with privacy and are in a setting where that privacy is intruded upon more often than would lend itself toward their ability to relax in the bathroom and have opportunities for toileting that facilitate their ability to relax and not have that intrusion that prevents them from that normal process. Poor intake of fiber or fluid might also be a problem. Individuals who have pica, who are not diligently supported in the safety measures that are necessary for that particular behavior, they're at risk of bowel obstruction, constipation, perforation, even death. So these are some of the ways that individuals with developmental disabilities may be at risk for constipation. So how do I identify individuals that I serve who might be at risk for constipation specifically? Well, some of the risk identifiers are that the person routinely takes bowel medications. And I'd like to just provide an example that when I, as a nurse consultant, go into some of the homes that I go into to review the records of an individual in there for a variety of reasons. One of the questions that we frequently will ask as nurses is whether or not the person has a problem with constipation. And more often than not, I'll be told no, because they've not been observed to have a problem with constipation. And as I begin to review the records, I'll discover that they take routine bowel medications such as a stool softener. So the caregivers have never seen a problem with constipation, so they don't think it is an issue. But what would happen if we removed that medication from their routine, they no longer took that stool softener that they take on a daily basis, then they probably would have a problem with constipation. So if they routinely take bowel medications and are under control in this situation, it does not mean that they're not at risk for constipation. And that's not including fiber products. We don't include that in that particular disclaimer. What we want you to do is be very watchful for individuals who take routine bowel medications. If those bowel medications are discontinued, that puts them at risk right there for a problem with their constipation. Also, the addition of medications that have constipation as a side effect is a time for you to be watchful. Psychotropic medications and pain medications post-surgery or dental procedure, those are times when an individual who maybe has never had a problem with constipation might have that problem arise. The person has required a suppository or an enema for constipation in the past year. That's pretty self-explanatory. An additional risk identifier is that within the past year, the person has had trouble moving his or her bowels, has complained of pain with a bowel movement, or had a bowel movement that is hard and small. Trouble moving his bowels, what does that mean? How do I know if someone that I'm serving has trouble moving their bowels? Well, if they've had no bowel movement for more than 2 days, that's an indication that they might be having trouble moving their bowels. If their abdomen is firm to touch, or their stomach looks distended or bloated, or they complain of abdominal pain, that's an indication that they may be having trouble moving their bowels. An individual who's vomiting without any flu or fever symptoms, an individual who's vomiting anything that smells like bowel movement, that's a very serious situation. Runny liquid stools after having had several days of small hard BMs or no bowel movements, that's an indication as well. Any change in that individual's normal routines, the number of times that they normally go to the bathroom suddenly increases, or they're staying in the bathroom longer than they normally would, rectal digging or scratching, changes in verbalizations or other routine activities of the individual, a decreased appetite and intake, that might be an indication also that they're having trouble with that. Painful bowel movements, that's very self-explanatory. And a hard, small bowel movement, particularly if the last 2 or more bowel movements were small and hard, that's an indication that they're having trouble with constipation.